Okay, more people are turning to plastic surgery to feel more confident, but is it for everyone? Well, plastic surgeon Dr. Shah of Beautologie dives deeper into this topic in his new book. Here it is, Making the Cut, 10 Things You Should Consider Before Having Plastic Surgery. Dr.
Yes.
Shah, thank you so much for coming on the show.
Thanks for having me.
Okay, so why a book?
So, over the last 15 years since I had started my practice here in Bakersfield, I've had hundreds of thousands of conversations, and you can't possibly capture everything in one conversation, one consultation that you need to talk about before you do plastic surgery. And we talk about so many different things, and I wanted to write a book to really encapsulate all of it so that people really get well educated before they go under the knife.
And do you think this is something, I feel like nowadays there's more shows on TV like Botched, and there's more, and because of social media, and it seems like more people now are turning to plastic surgery, where beforehand maybe it was something people didn't talk about, but now I think people are like, wow, I only live one life, I'm not happy with this, I'm gonna go get plastic surgery, right?
Right. And therein lies a danger, though, too, because it gets more and more accepted, and people start thinking of plastic surgery as akin to maybe getting a facial or getting a nice haircut or something. And it's really still surgery. It's still serious medicine, and people really need to make sure they take control of their health, take control of what procedures they're doing, and make sure it's safe for them. It's not as easy as it sounds and looks on TV sometimes.
Not just like, oh, I want to get a smaller nose, I just go in, right?
Yeah, it's not like you go in before commercial break, come out after commercial break, and everything's healed and done, So
no, it's more than that, right? So in the book, you talk about the number or percentage of patients that not to operate on, right? So what is that percentage?
So, in my practice, it's probably about 25 to 30%. I think it's a healthy percentage. And, we're not looking all the time to just refuse everyone from plastic surgery, but we are looking for people that are just not ready. And some people might never be ready to have plastic surgery because their health or their psychology is not in the right place. But about 25 to 30% of people that come into our office, believe it or not, we do tell them to wait and do other things before they pursue doing plastic surgery.
It's kind of crazy because I would think people out there would think, hey, you're a doctor and you do plastic surgery, you're turning people away.
Right.
But you do. So some of the reasons why you turn people away, what are those reasons?
Yeah, so in fact, it's so funny because the publisher of this book made me change the title because they thought the original title was 10 Reasons Not to Do Plastic Surgery. They thought it was a little bit harsh. But some of the reasons that we don't do plastic surgery, I would say the number one reason is people are not healthy enough. They are either have diabetes, they're overweight, they have other medical issues that need to be resolved before they undergo surgery.
Okay. And another one, we have it on the screen, smoking.
Oh yes, smoking is a big problem actually. I can't believe how many people still smoke, but if you do smoke, it reduces the blood supply to your skin. And believe it or not, your skin is one of the biggest organs we have in our entire body, but it has the smallest blood vessels. And so those blood vessels get clamped off. Without blood, your skin cannot heal. So smoking is a definite contraindication to surgery.
If you are a smoker and you want to get plastic surgery, like what is that time frame to stop before?
4 to 6 weeks.
4 to 6 weeks. Okay.
Yep. Not a single cigarette. And we do nicotine test people to make sure there's no nicotine left in their blood.
Okay. And then unrealistic, what was it? Unrealistic expectations.
Yeah.
Is that like the, I want to go in and look like, I don't know, Barbie?
Right.
We've seen that, right?
That's exactly what it is. And people, I think, there's so much out there in the media, so many pictures in tabloid magazines about people getting plastic surgery. And what people really need to look for when they're looking at before and afters is look for someone that had surgery that looks like you before and look at thereafter. That gives you a more realistic expectation. And make sure you have that conversation with the doctor. Ask them specifically, what can I realistically expect from this? And make sure it aligns with your thoughts. And if it doesn't, you need to take a step back and reconsider.
Okay, so your book is available now. Where can people get it?
So you can get it on Amazon.com, BarnesandNoble.com. You can get it on Kindle. It's everywhere. Everywhere you can buy a book, you can buy this one.
Okay, Making the Cut, 10 Things You Should Consider Before Having Plastic Surgery. And it's an easy read, too, so we like that. Okay, Dr. Shah, thank you so much. And good luck with your book.
Thank you so much for having me.
We'll be right back.